Good evening, everyone. It's a full house today. I don't know if it's a topic or it's the weather or it's me. I don't know what it is, but thank you very much for coming. I really appreciate. Apologize for not having one last month, but this is our monthly last Tuesday of the month workshops that we do. So we're back on track. We'll probably do one more in May, and then we'll be off for the summer and we'll restart again September, October. So let me introduce myself because it happens all the time. Either new people and I don't tell who I am. And then, at the end they're asking, who are you? So my name is Aziza and I am actually a pharmacist at King City Pure Pharmacy and Wellness, which is located at Dufferin and King in the Copas Plaza. I'm actually also a nutritionist and a wellness coach. So that combination makes me feel like I'm more of a holistic pharmacist because I like to think of illnesses in a very holistic way and, healing illnesses in a very holistic way. And so one of the reasons why we do this seminars is really to empower our clients with the knowledge they need to really look at their disease and the healing and the wellness in a more holistic perspective, because there's so many different ways of healing. And so that's a bit of background on me. If you want to know more about what we do, more of our story, you can go on our website and you'll find all the information. The website is at the bottom. So the topic for today, inflammation. Now, this was actually a topic that was requested. A few people requested early on when we started this about inflammation. And I knew this was going to be a big topic. It was going to require a lot of time for me and also to make it in such a way that is understandable and we kind of sort of build on it, right? So when I started doing this, I realized, oh boy, this is going to be not one time. We're going to have to do this over a few sessions. So I did tell the librarian, this is probably going to be a series, so we start from the bottom, we actually understand what inflammation is, because that's a word that goes around quite a bit. I'm sure all of you have heard this word, inflammation, anti-inflammation, right? But we want to understand what exactly is it. And then when we know that, then we know how it's affecting our health and what we can do to sort of control that inflammation in our body. So that's why this is really sort of like a groundwork. So we're all on the same page. And I will talk about some of the things we can do, but I won't do it justice if I go into details of what you can do to reduce inflammation. I'll give you the basics of it, but what we'll do is, again, this is part one. We'll have part 2, 3. We'll go into deep dive into each of the different things, right? So even if you walk away thinking, oh, I don't know what I'm going to do, don't worry too much about it. You'll get a little bit of it, but this is really an overview because, again, it's a huge topic. So let's get started on understanding inflammation. Okay, so what is inflammation and why should we care? Why does it matter, right? So inflammation is actually a natural process in the body. It is something that our body needs. It is what you would call a protective process, right? Our immune system uses the process of inflammation to actually protect us from harmful substances. So you can't really say inflammation is all bad because it is, and anytime there's anything that's happening in the body, there's innate wisdom. Everything happens for a reason. The problem happens when that process goes wrong because of what else we're doing or what else is happening in the environment, right? So inflammation by itself is a good thing. If we didn't have inflammation, we wouldn't last very long. We wouldn't survive past our childhood because, like I said, inflammation is actually very protective. It is a process the immune cells uses to save us from all kinds of foreign objects, whether it's bacteria, viruses, toxins, chemicals, anything that's bad for us. The immune system uses inflammation, the process of inflammation, to protect us, okay? So as a process, it's not a bad thing. Why is it that we consider inflammation as bad? Why is it that we're always talking about inflammation is causing this disease and we need to be anti-inflammatory this, anti-inflammatory that? That comes from understanding the difference between acute and chronic. And that's the key with a lot of things that happen in the body. Whether it's stress, acute is okay, chronic is bad. Inflammation, acute is great, chronic is bad, right? So that's where we kind of distinguish between what is good inflammation and what's bad inflammation, okay? So let's get to the bottom of inflammation. What exactly happens? So I put a picture here. Now, I'll use a very simple example when you have a cut to your skin, right? Or a mosquito bite for that matter, right? whatever happens in the skin is actually through the process of inflammation, right? Step one, like it shows, an injury happens and a harmful object is detected. So here, say you got a prick from a pin, right? We're like, the skin is actually a barrier. It protects us from so many things, right? So when there's a puncture, there's a hole, bacteria can get in, chemicals can get in, things we don't even realize, right? But this is what the immune system is protecting us from. Immune system, all the cells of the immune systems are running around in the bloodstream, right? So the blood vessels are right underneath our skin. As soon as there is an injury, the immune system, being very smart, it's like the army we have, it goes in and it detects danger and it says, oh, I better send immune cells, right? So it sends all these cells that they leave the blood vessels, go into the tissue, gobble up all the bad stuff. They're actually immune cells that are known as phagocytes, which actually gobble up these things. They're actually like those Pac-Man, you know, they eat up this stuff. So this is real. They go in, they take care of it, and then it goes to the lymphatic system and goes out the body. So they're really protecting us, right? Second step, again, immune system starts inflammation to mob the invader or dangerous objects, right? So it's through the process of inflammation that the immune system clears up all that's coming. Third step that happens is that the immune system initiates this anti-inflammatory process. This is all part of the cascade. Inflammation has to happen. And after that, it's the immune system, because it's very wise. Our bodies are very wise. It comes along, creates all these anti-inflammatory chemicals that shut off that inflammation. Okay, so then the body is back to balance.
Thank you.
If someone's actually, can everybody make sure they're muted on Zoom? Thank you. So that's really the process. It's a three-step. Immune system detects danger. It starts the process of inflammation, and then it shuts itself down as well. So there's inflammation and anti-inflammation happening, okay? Now, most of you know, whether you've had inflammation in your joints or, anywhere there's inflammation, these are the 5 common signs when you have an inflammation. They don't always happen, especially if the inflammation is happening inside your body. If it's happening in an organ, if it's happening in a vessel, blood vessel, you're not going to get pain, right? Because there's no pain receptors there. But let's take the example of a joint or skin, or when you have a mosquito bite, right? These redness, swelling, heat, pain, and loss of function happens, right? These happen because, like I said, the immune system releases these inflammatory chemicals that are known as cytokines. Don't worry about the name, but I have an example. That's why I kind of brought up that name here. Their job is to remove those substances, and then there's anti-inflammatory cytokines that heal the area, okay? So why do we get these 5 things that happen? Because remember, when there's an injury or there's a harmful object that's entered the body, or there's a toxin in the body that the body is trying to get rid of, it increases the blood supply to the area, right? When you increase in blood, there's going to be redness and there's going to be heat, because that's where the warmth comes from, is the blood, right? Then what happens is all these white cells, remember in the diagram I showed you, they are coming in through the blood cells, going into the tissue, right? Right now, before they're in the blood vessels, they go into the tissue, and as they move in, they also, liquid moves in as well from the blood, and that causes the swelling because there's all that fluid that comes into the tissue. So you can understand why that swelling happens when you have inflammation. When you have that buildup of fluid, that also if there's pain receptors in the area, it will push on the pain receptors, activate the pain receptors, and then you feel the pain. If you're talking about the joint, that's what happens, right? That's why you get immobility in the joint, you get heat, you get pain. You can't see the redness because it's inside, and it immobilizes the area. And one of the reasons for immobilizing the area is really so that the body can heal. There's always wisdom in it, right? The issue happens is normally you're supposed to downregulate, right? Remember, when inflammation happens, it takes care of whatever was wrong there, whether it was a chemical, whether it was a bacteria, and then the anti-inflammatory process happens by the immune system. The immune system is supposed to inflame and then anti-inflame. And that's when you go into balance. The problem happens is when there's an issue with the anti-inflammation, okay? So that's why we want to distinguish. Remember, I talked about the 2 types. So now everybody understands the inflammation. I had a few slides on it to understand what actually is happening. Are we okay with that? So here's the difference between acute and chronic. So when acute happens is, like I said, if it's a mosquito bite, the saliva of the mosquito is something foreign to the body, and immune system says, oh, I better mount an inflammatory response to take care of that. It gets rid of that chemicals that are in saliva, creates anti-inflammation, and that swelling is there. Once it heals, it goes down. That's called acute inflammation. Everything is good. Chronic happens is when our immune system is dysregulated, which means it's not working the way it's supposed to work. And we'll talk about why that happens. So what happens is it can't turn on the anti-inflammation. Remember, the inflammation happens to take care of that, whatever was harming us. After that's taken care of, the immune system has to turn on the anti-inflammation part. When our immune system isn't working, the anti-inflammation doesn't happen. So that storm, that fire of inflammation continues because there's nothing there to shut it down, okay? And that leads to this low-grade inflammation that constantly goes on. So when we have, body aches and pains and whatever, because there's low-grade inflammation happening in our body, okay? Because immune system is likely dysregulated, and we'll talk about the reasons for that. The other thing can happen is, let's say, if you have an injury, right? Whether it's physical, whether it's internal, whether it's a toxin that you're constantly putting into your body. The immune system is trying to take care of the toxins, but you keep ingesting the same toxin over and over and over. Well, the inflammation is going to continue, right? Because that's what the immune system is high alert because that toxin keeps coming. For example, smokers, right? If you're smoking, you're constantly releasing the toxins. So the immune system is constantly active. And I don't think it's, so I was just gonna give you an example. Oops, sorry. I'm like going forward when I'm supposed to go backwards, sorry. I was going to give you the example, which I'm sure all of us remember, of the COVID-19 virus, right? Which happened, we all remember, thank God it's gone. But when it happened, do you remember at the beginning, before we had the vaccines, right? There were some people who were really getting affected by it. They were ending up in the ICU, their lungs were collapsing, while others had the infection, they were sick for a little bit and they got better, right? So most people did get better, right? But there were some people, and they were talking about risk factors, people maybe who had other health conditions, people who are obese, people who are smokers, they were at higher risk, right? So here's the thing, when the virus was infecting, right? It wasn't the virus that was killing us, it was the inflammation. Because remember, virus is a pathogen, it's a dangerous thing coming in. The immune system gets activated thinking, oh my God, I gotta attack this thing. And it does it through the process of inflammation. So I don't know if you guys remember, but I remember I used to be at the hospital and we were always talking about this whole issue of cytokine storm. So that's what was happening with a lot of these people who are ending up on ICU, is because they were getting this cytokine storms. Now remember, cytokines are those chemicals released by the immune system, which are inflammatory. They cause the inflammation. Then the immune system is supposed to shut down that inflammation. What was happening in some of these people, because their immune system was likely dysregulated, wasn't working as well, they were having all these cytokines coming in to take care of the infection, but there was nothing, the anti-inflammatory response wasn't strong enough to shut it down. So it became like a cytokine storm. So what happens if you have too many of these chemicals that are supposed to kill the virus, they kill the virus, but at the same time, they kill normal tissues. And that's why so many of these people who ended up in ICU was because their normal lung tissues were getting damaged because of all these chemicals, these inflammatory chemicals that were really there to kill the virus, but the system to shut it down was not working as well, right? And that's why, so cytokine storm became like a really big thing when they were talking about COVID-19. This was way at the beginning, and then of course things got better as we got vaccinated. But so I just wanted to give you the example of really the role of inflammation and how it's really important that when the inflammation is happening, we also have anti-inflammation that happens afterwards, so we can bring everything back into balance. So again, this is just a summary. No matter what the injury is, the inflammatory process is always the same, right? Cells come in, they gobble up whatever is, dangerous, whether it's a pathogen like a bacteria or virus, whether it's a damaged cells, because remember, our bodies are constantly turning over cells. It gets rid of cells which are not working well, because if those cells stay in our body, it could cause problems, right? So the immune cell is responsible for that as well. It's also responsible for getting rid of any toxins, chemicals that we sort of ingest through our food, anything that goes in that doesn't belong in our body, the immune system gets rid of it through inflammation. Once that's done, it wants to calm itself down, anti-inflammation, and everything goes back down to balance. Oops. Am I going backwards again? Okay. Really a lot of technical issues here. Okay. So this is what we're aiming for, a balance, right? It's not that you don't have inflammation. You'll always have inflammation because you always have toxins coming in. You always have damaged cells. You always have exposure to viruses, pathogens, all kinds of things. It's about making sure that your inflammation and your anti-inflammation is balanced, right? What happens with a lot of times when we suffer from illnesses is because we have too much inflammation and not enough anti-inflammation, right? So that balance is tipped. And so really the things that we talk about in terms of rebalancing is really about working on this area, okay? Let's make sure we go in the right direction now. Okay. So now many of you probably know that any of the diseases that are called itis at the end are associated with inflammation, right? That was the old way of thinking that yes, itis is inflammatory, and oftentimes they could be acute, like for example, bronchitis isn't long-term, right? Even if you have pneumonia, any of those infections, there's inflammation, but it's short-term, right? You take things to feel better and then it goes away. The body will take care of it. Sometimes it's long-term, right? Colitis can be short-term, but it can also be long-term. The understanding in the past was that anything that ends with itis is inflammatory. But what they found now, and it's on the next slide, is that many, many illnesses actually have inflammation as a starting point. It's kind of like that common soil that diseases grow from. And that's why it's really important for us to understand inflammation and recognize what we can do to help ourselves become less inflamed, okay? Now, before we go to the next slide, I just want to throw this in here that can you measure inflammation in the body? Yes, you can. In fact, we used to do CRP levels as a very common way of measuring inflammation. We used to do that often in the hospital. Your doctor may do it. When I was really inflamed in 2019 with my condition, CRP levels, my doctor's like every few months sending me for CRP levels, and they did go high and they came down, right? So that's a good indicator. There are other things like in IL-6 levels, ESR, and there's other markers, but CRP is usually a good indicator. So I don't know if you've had any lab work done, you may have had that done, but so that if you see the CRP levels, that's an indication of inflammation. Now, it could be any inflammation. If you have a urine infection, your CRP levels will go up as well, right? If you have, what they were also finding is people with cardiovascular, like if you have any heart conditions, CRP is a good indication of their risk. If their CRP is high, they're at higher risks, right? So that's some doctors kind of will measure that, but not everybody. So you know what CRP levels mean and that they can be indicative of inflammation in the body. So here's the surprising slide for you guys probably. What they're finding that a lot of chronic conditions, the common thread between them, almost like the soil, is inflammation. Is everyone surprised, or did they think that this would be the case? Yeah. In fact, they're talking a lot about neuroinflammation, like inflammation in the brain, right? They didn't think that was happening, and a lot of degenerative diseases are also related to inflammation in the brain. Coronary artery disease, right? Anything to do with the heart, high blood pressure, even, if you guys have heard of atherosclerosis, right? The hardening of the arteries. They used to think it was cholesterol, and cholesterol is involved, but what they've actually found is before cholesterol, remember the root cause is really an injury to the lining of the artery. So that injury, again, the immune system says, oh, I have to fix that injury, right? There's cells which are damaged. It comes along and it starts healing. And in that, it's almost like, you know how we create a scab? It's almost the idea inside the artery, that scab, which is like the plaque that forms. And cholesterol is part of that because part of the healing, sort of healing process. But if the injury keeps happening, you know, that the plaque keeps building, right? So that's I would say in the last 10 years, I think they've determined that a lot of these things, the bottom line is inflammation. Cancer also, inflammatory beginnings, right? Alzheimer, diabetes, and insulin resistance. Insulin resistance is becoming very common, especially with metabolic disorders like PCOS. Same idea, starts with inflammation. Asthma is inflammatory, inflammation of the lungs. Osteoarthritis is another surprising one. When I was in school, we were taught it was wear and tear disease, right? As you get older, everybody's gonna get it. Well, what they found is actually there's a lot of inflammatory markers involved. So it's actually inflammation, right? Allergies, cardiac arrhythmias, Crohn's, and anything to do with the GI inflammation. It's all, and there's more, right? So I've just listed some of the ones which were surprising to me too, but there's, and I've listed at the end some references. If you want to go read more about it, you can read about the research that's behind all this. So that's why I think it's really, really important for us to understand inflammation, right? Understand what role we can play, because I really believe that, you know, we need to be active partners in our healing, right? And when we understand where inflammation is coming from, we can take those small steps. And I have firsthand experience, because when I got sick in 2018, I think 2019, I was really, really inflamed. I didn't think I would be here, standing here 5 years later, you know? So I truly believe that there's real power in recognizing what's inflaming us and working on that. So this is what that means, right? That chronic inflammation, reducing chronic inflammation in our body is a good thing. Not only for preventing diseases, because yes, it will, right? As we're less inflamed, chances of developing those chronic diseases go down, right? But also healing from illnesses, right? Just because it doesn't matter where you're at. Like I said, you know, in 2019, I was so inflamed, just about every joint in my body was hurting. I didn't think I would get to this point, right? But my inflammation went down. I still have a little bit of it, but to the level that I was, to where I am now. So it doesn't matter where you're starting off. There's still ways of reducing inflammation in your body, right? It doesn't, just because you have a diagnosis of an illness doesn't mean it's the end, right? There's many, many ways of managing and you know, giving the body what it needs to reduce that inflammation. Am I going backwards again? No. This is the second one I have. I thought I saw this before. Okay, so this is what we need to do, right? We need to do less of what inflames us, right? And we need to do more of what increases the anti-inflammatory markers, anti-inflammatory chemicals in our body, right? Because we want to bring that back into balance. So we want to drop the inflammation down, we want to drop the anti-inflammation up. So that's where lifestyle factors come in. Again, like there's many ways. There's also medications, right? There's supplements, but I really want to start off with things that are in our control, free, we can do ourselves, okay? Then we can move on to other things you can add on, but really I think we need to first start with what's in our control in terms of lifestyle. So before we go on to this, like I said, these are 5 well-studied, well-documented things that affect your inflammatory markers, okay? This has all been studied, there's all evidence on this. But I won't be able to go into too much detail, again, because we're halfway there and we won't have much time. But each of these could probably create an old workshop. And that's what we'll do. We'll go into each of this in details, but I'll go through quickly just explaining why they have an impact on inflammation in the body, okay? But before we go on to this, is there any questions about the process of inflammation before we jump onto this?
So by knowing what your things are that are causing it, you know, to
Yeah. And it's different. It is different for really everybody, right? It's just yeah. Like I think for me, my diet wasn't that big of an influence, but my stress was huge. As soon as I started working on my nervous system regulation, my inflammation started going down, right? So for everybody, it's different. And just knowing, it could be sleep for you. For me, sleep wasn't an issue, right? So I knew that wasn't. But for some people who are inflamed, if their sleep is an issue, maybe that's what needs to work on, right? So these are really, I would say, 5 of the main things that we can actually, that's within our control, that we can work on, that we can identify in ourselves, right? What's going on, and then we can work on it. So let's go through each one. Okay. So chronic stress, again, remember, it's acute is okay. If you're under acute stress because you got to run away from somebody or from a bear or lion or whatever, it's fine. That's okay. It's when it becomes chronic, when that, I always say, like when the bear ends up in your head, right? That everything becomes stressful, is when your nervous system is constantly activated, right? If you are chronically in that flight or fight, right? Or if you're chronically stressed, your immune system is going to be affected. There's a new field of study. It's called psychoneuroimmunology, which is they're actually looking at how our mindset, our thoughts affect our immune system, because it's not separate. It's the unfortunate part in the medical community we've done is separate the mind, the body. They are not separate. There is so much evidence. Mind and body is connected because our thoughts release chemicals in our body. And that's what actually happens. And I want to kind of explain this. If you don't get it too much, that's okay. We'll come back to this topic later on in the year. But what happens is when you're chronically stressed, so cortisol, everybody knows cortisol, right? That's the stress hormone. So when you're in that flight or fight mode, and when you're on this constantly on an everyday kind of basis, you release a lot of cortisol. So your body is almost like, I would say, swimming in cortisol all the time. Now, here's the interesting part, right? Cortisol, how many of you have actually used cortisone shots or, cortisone cream or anything like that when you are sick? Has anybody used hydrocortisone, right? So cortisol is actually an anti-inflammatory drug, right? Okay. So it is, right? Yeah. Broncho, yeah, they're all, so it's a very commonly used drug, right? Every time you have a skin rash, cortisone-based cream. Every time, it's asthma attack, cortisone based. If you have, the shots they give you it's cortisone, right? It's an anti-inflammatory chemicals. So if you're stressed, you have a lot of cortisone, it should be a good thing if you think about it. You have a lot of anti-inflammatory product, right? But here's what happens. And that's, those of you may have heard about insulin resistance, right? What they found that what's happening is cortisol resistance, okay? So let me give an example, sort of like, and I do that with insulin resistance well. Say you have a neighbor that constantly comes and knocks on the door, wants eggs, wants to borrow sugar, wants to borrow this, wants to borrow that, constantly on the door, right? There'll come a point where you'll say, I'm not opening this door anymore because this guy's bothersome, right? Same thing happens with cortisone. It's constantly, we're swimming in it if we're stressed out, right? So it's constantly going into, knocking onto the door of the immune cells, to the point where immune cells like, you're there too much. I don't want to open it. They become resistant to cortisone. So cortisone is the main anti-inflammatory chemical for the immune system. But if you're constantly surrounded, our cells become resistant to cortisone. So when we need cortisone to do its job, when there's inflammation, we need cortisone to shut that inflammation down. The cells aren't going to listen to the cortisone because they've shut off. They're not opening the door anymore. Does that make sense? So this concept of cortisol resistance makes sense, because this is how, if you're chronically stressed, you're not going to be able to start that anti-inflammation that needs to happen for that inflammation to shut down. And that's why, during that pandemic, the people that were, there were some examples, young people, maybe their stress levels, no one was looking at that. No one was looking at the cortisol resistance, right? I don't even think there's a measurement of it. This is something really new that they've figured out. That's what's happening when you're stressed. So we know that stress is not a good thing. Okay, whether it be physical, emotional, psychological, And oftentimes, you know, when I bring this up, those of you who have had a medication review with me, you know I always bring this up. I will always talk about the stress. But oftentimes we feel, and I did too, 2018, I was in a emotional roller coaster for like whatever, 48 something years. I did not realize that this was in my control to regulate my nervous system. I had no idea. I thought, well, that person does that to me, or that person does that to me, right? A lot of times, often we don't realize, we feel that an environment is stressful, hands down. You know, environment is stressful. I've got 3 adult, teenage adult kind of children. Environment is stressful, right? I get it. But it's oftentimes our perception, right? And our perception comes from our past or limited beliefs. There's a real process behind it. And also you have lots of breathing techniques. There's lots of ways of regulating the nervous system. That's all I want to leave you with. We can't really go into the details, but we will. But just know that if this is something that you experience a lot of and you find your body is inflamed, maybe this is what you need to work on. For me, this was a game changer. And that's why I'm so passionate about this, because this was really huge for me. You know, and I really credit this and gut healing, the 2 main parts for my inflammation to go down. So let's move on to the next one, which is diet. Now, a lot of people know about diet, right? There's a lot of information out there about foods that are inflammatory and foods which are anti-inflammatory, right? And this stuff is also real. And I think, again, it depends on different people, different things are inflaming them. Like I said, for me, it wasn't a big deal. But I had a client, right? Very early on when I did my nutrition. And so, you know, he was suffering from a lot of joint pain, right? Joint pain, knees, back pain. And so again, I was a new kind of qualified with nutrition, and I thought, well, let's work on your diet. And what we realized that he was having a lot of a Coke and chocolate on a regular basis, right? He wouldn't have connected it. I thought, well, that's probably not a good idea. Let's reduce it. It was incredible how quickly, I would say within 4 weeks, you know, his pain level went down to the point that he was actually thinking he was going to get disabled. Like he was going to develop arthritis, this, that. His pain level went down because for him, sugar was inflammatory, right? It's that sugar roller coaster that's also bad for diabetes, can be very inflammatory for some people. You know, it wasn't the case for me, although I wasn't having a Coke and chocolate every day, but, you know, so depends on what your diet is, right? It may not be, or it may be. It could be excessive load of preservative and chemicals. A lot of times when we have processed food, right, too much of it, we're getting too much of that, right? And if the body has to constantly deal with that, right? And that's what's causing inflammation. And if your anti-inflammation isn't strong enough, you're going to be constantly inflamed because your body is exposed to all these chemicals that are foreign to it, that it needs to get rid of. Again, many of you have heard about Mediterranean diet. It's probably the best anti-inflammatory diet, you know, whole foods, fish, colorful vegetables, fruits. And again, when we do a full topic on anti-inflammatory foods, we'll talk more about each of them and why that works. But just know that you need to choose wisely when it comes to food. Mm-hmm. It does have an impact, okay? Now, gut microbiome. Again, that's probably a new topic for many of you. This is also, there's a lot of research now coming up saying that a lot of inflammation actually begins in the gut. And we'll talk a little bit about the gut microbiome, again, another topic. Our gut is housed to trillions of little critters. All these bacteria, pathogens, viruses, fungi, you know, they combine together, make the gut microbiome. It's called the gut microbiome, right? It's like a whole world inside of us. You know, it's like a whole ecosystem. There's diversity, there's different types. 70% of the immune system lives in the gut, right? And it makes sense because remember, the immune system's job is to protect us from foreign things coming in, you know, any of the damaged stuff, all that stuff, right? If you think about it, it's starting from the mouth right to the back end. Our body is kind of like a donut. That in the system, the GI system is like the hole in between. It's actually exposed to the outside. So all the chemicals, all the viruses, bacteria can get in. And our body, it makes sense why 70% of the immune system is actually located in the gut, because we're exposed to so many of the toxins coming in. Mm-hmm. So that's one fact. Now, the other thing, all these bacteria that live in there, right? there's a balance. There's good bacteria and bad bacteria. You can't have too many of the bad bacteria, because when you do, it is what called dysbiosis happens, right? Now, those bad bacteria are the one, they actually digest food, they digest the food we eat, they create chemicals, they make inflammatory chemicals, and they're bacteria that make anti-inflammatory chemicals. So remember, if we have too much inflammatory chemicals, we're going to be inflamed. And these bacteria actually play a role in making those inflammatory chemicals. And they're good bacteria that actually make the anti-inflammatory chemicals. So we need more of that. So we need a good balance, right? The other thing that bacteria do, which is really, really also important for this part, is they protect the gut lining. Now, remember, you know, like the skin is a barrier, the lining of the gut, right? That protects the outside from the inside. So it protects, it doesn't allow bad things that are going through our gut to get into our body, because if it does, that's when our immune system will react and say, hey, this is foreign to me, why is it coming in? And we get inflammation. That lining needs to be intact, but it's very thin. And the gut bacteria actually protect the lining. And if there's an imbalance, that lining can get holes in there. It's called intestinal permeability, or sometimes you may have heard of leaky gut syndrome. That's like the common way, but intestinal permeability is well studied in scientific literature, and they're beginning to find that if that's not intact, you can have toxins get into, and as soon as it gets into the body, into the bloodstream, the immune system is going to react because it's toxin, it's foreign, right? Remember, the immune system is very smart. Anytime it detects something that's foreign to it, it's going to mount an inflammatory reaction because it wants to kill it. Right? It's our army, it's our military, it's there to protect us. So the gut bacteria do a lot. They interact with the immune system, they create these chemicals, they protect the lining. So it's really, really important that we actually look after our gut, right? And oftentimes we don't even know, like for example, when I was diagnosed, I knew gut had a role in it, but I had no idea. Now, again, years of having gut issues, years of being under stress, you know, but I'm not managing my stress properly. All that damages the gut. Now, all these things are related, right? Gut health is related to the stress, which is related to the diet, which is related to sleep. Nothing is in separation. Even though I'm presenting it separately, like I said, it's all holistic. We're all one. So when you work on one, it helps the other one. If you help the other one, it helps this. So it's all interconnected. But the point for me to bring this up is to make sure that you understand that the gut plays a huge role in inflammation, right? And if you're having any issues with your gut, that could be the place where you need to start in order to, you know, manage the inflammation in your body. Yes, absolutely.
So you said you could get a little hole in that.
Yeah, like no, it can. The gut lining actually replaces itself. I think it's every 4 or 6 weeks. I don't know, but it changes over. Like those cells, new cells come on. It's not a permanent, it's not like our skin, like even our skin, like it will heal itself, right? The body will heal itself. As long as whatever was causing the holes is not there, right? If you keep, like for example, for the skin, if you keep cutting at the same area, it will not heal. It's the same thing with the gut lining as well. If you keep damaging it, depending on what you're eating, right? The foods matter, you know, the bacteria, the type of bacteria, because they really protect the gut lining, right? The amount of mucus production, all that. So our diet is huge in that. Stress is huge, right? There's a gut-brain connection. So the gut and the brain are always talking. So there's a lot of things that play a role. But yeah, it's not something you go to a doctor and they'll give you something to fix it. The body does fix itself as long as we support it.
Aziza?
Yes?
Yeah, just for those of us on the line, it's hard to hear the speakers in the room when they ask a question. If you could repeat the question, that would be great before you start to answer it.
Okay, sure. So the question was that can the holes in the gut lining, right? The intestinal permeability, can it fix itself, or do you actually have to go to a doctor to get it fixed?
Right.
Okay, yeah. And so you heard the answer though, right?
Yes, we did. We got the answer. Yeah, no, it's just,
okay, good.
Thank you.
No, thank you for pointing that out. Thank you. So We only have 2 more, so we have enough time. Okay, so sleep can increase your inflammation, and not just too little sleep, which was actually a surprise for me. Too much sleep can actually increase your inflammatory marker as well, which is important for me because if somebody gave me time to sleep, I would sleep all day. So too much sleep is also not good. Too little sleep is also not good, because what they found that it increases those inflammatory markers or inflammatory chemicals in the body. Okay, they say 7 to 9 hours is average. I would say, based on yourself, if you know when you've had a restorative sleep, right? If it's 5 hours for you, if it's 6 hours for you, you know when you've had a restorative sleep. As long as you're getting that, you're good. And the reason why, the sleep is so important, because sleep really controls the circadian rhythm, which is like, it's like an internal clock. Every cell has it, and it's based on our circadian rhythm, which is based on some of the new research coming out is saying is actually getting sun first thing in the morning is really important, right? And that's something I've been trying to do too, even if it's just stick your head out the window, just to get that morning sun. It kind of resets the circadian rhythm, right? And that's why sleep is so important. And the last thing I wanted to point out, that sleep and stress are interconnected, right? Oftentimes people aren't sleeping because their stress hormones are so high. So remember, cortisol is your stress hormone, melatonin is your sleep hormone, and they're kind of like this. If cortisol is high, melatonin will be low. So if you're having trouble sleeping, it could be related to the stress, and you really need to work on that to bring the cortisol level down so your melatonin can go up, right? There could be many, many reasons for sleep disturbances. Again, if you find that this is an issue for you and you're finding yourself inflamed, then maybe that's where you need to work on, okay? And the last thing, I believe it's the last thing, is exercise. And oftentimes that becomes an issue if your joints are inflamed. And I know that was the case with me. I was so inflamed, I thought, how am I going to work out? So I actually joined the gym so I could just go to the pool. And that's all I could really do at that time. It was so, I could barely lift even a plate, let alone any weight, right? So it's not the amount. In fact, too much exercise can be inflammatory. So you really need moderate amounts. So even if your joints are hurting, just 20 minutes of, even like, you can do fast walking, even slow walking. I know a lot of people do Tai Chi and actually read up on Tai Chi, and Tai Chi actually lowers inflammatory markers as well. So exercise in any form, a sedentary lifestyle can really increase your inflammation. Whatever little, 20 minutes a day, just a walk has been found to lower your inflammatory markers. And remember, that's what we want to do. We decrease the inflammatory markers, right? The other thing it can also do is reduce the fat cells in the body. Now, fat cells actually release inflammatory chemicals, right? And they just become almost like the adipose tissue. They found it becomes like a releaser of inflammatory chemicals. Remember, we talked about the cytokines. So the more fat you have, the more inflammation you'll have. And exercise actually helps reduce the fat cells, right? So that's how it helps. So we've got, I don't want to finish right at 8. I think this is it. Okay, this will be continued. Again, I know it was really rushed. I didn't want to leave you with just what is inflammation and not give you some hope that, yes, there's something we can do. So that's why I kind of went through that. And I thought, I know it's kind of rushed and there's a lot I can say. And I know you'll have a lot of questions, but this will continue. This will continue in fall 2023 if things are good with us. These are some of the references. Again, what I usually do, if the recording is good, I will post that. We have King City Pure Pharmacy has a YouTube channel. I post all these workshops as long as the audio is not bad on there. And if you're on my email list, I will send you a link anyway. So you will have, so if you want to go ahead and read more about it, these are the references. Normally, I don't have my workshop topic for next time, but this time I was kind of inspired and I thought, it would be really nice because it's been 5 years since I was diagnosed with my actually autoimmune condition. And like I said, when I was diagnosed, I did not think, I was told I could end up in a wheelchair in 5 to 10 years. I did not think I would be standing here talking about this. And so I really think it would benefit for people to know that it doesn't matter where you are. Like I said, I was like full on inflamed. Every joint in my body, joints I didn't even know existed, were inflamed and in pain. And to be able to come to this point, right? It was a journey. I learned a lot of lessons and I really want to share that with you. So this is all going to be about kind of my story. So that's going to be the last Tuesday in May. And then we will be done for summer and then we'll resume again. And so you guys know how to find me. If any of you here is not on my email list, I've encouraged you to join just because that's the best way for me to get information out to you. You know, I don't necessarily get the posters up at the store in time. I'm not good with social media that much. So if you are on the email list, you will get the Zoom link in time. You will get all this information. And so I think that's the last of it. You know, everybody seems a little confused. I hope. I know there's lots of questions. I can take some now. If you have any questions, you can email them to me. Out of the online peeps have any questions? Yeah, go ahead.
How do I know if I have information? Assume?
No, so sorry. Oh yeah. So thank you. Someone's asking for the online people. Someone's asking here, how do I know if I have inflammation in the body, right? So remember the 5 signs I talked about. Oftentimes inflammation shows up as pain. If you have pain anywhere, it's likely inflammation. Okay. Yeah. There's always inflammation. Then we talked about all those illnesses, right? We talked about, you know, diabetes. We talked about any of these gut issues, any heart condition, high blood pressure. All those, inflammation is at the root cause. So if you're healthy, everything's good with you, I would say you work on inflammation to reduce inflammation so you prevent disease. If you have a condition that's giving you pain, if you have any stiffness in your joints, in your body, if you have any gut issues, if you have like, you know, pain or even like diarrhea, all that kind of stuff, you know, colitis, all that's related to inflammation, right? So that's usually a way of looking at yourself and saying, oh, I may have to work on my inflammation. If you're healthy, you may not have anything pending, but working on your inflammation is always a good idea to prevent illnesses. Like I said, Alzheimer's, any cognitive decline is related to inflammation in the brain, right? And as we age, that's one thing everybody's worried about, is maintaining their cognitive abilities, right? While lowering your inflammation in your body by increasing anti-inflammatory things is going to lower your risk.
Yeah, that's what I can see also trying to prevent.
Yes.
Prevent inflammation.
So you can prevent it. You can prevent illnesses by working on your inflammation, by reducing your inflammation levels, right? You may not know you have it, right? But like I said, a lot of these illnesses, for example, cognitive decline, right? You know, dementia, Alzheimer's, that's all related to inflammation, right? So as you get older, I get a lot of questions from elderly people coming in and asking me, well, what can I take, right, to prevent that? And yes, they're anti-inflammatory sort of supplements, but there's a lot of lifestyle hacks that we can do, right, to prevent the chances of us getting that illness. Does that kind of make sense? No? Okay, we can talk after.
Right.
Go ahead.
A lot of great people. I was wondering, putting aside sleep and exercise and look from a diet perspective, do you have, let's say, 3 top food items that we can start implementing currently in our lifestyles of foods to incorporate and maybe 2 foods to start limiting or reducing altogether something else with their diet, just to kind of get a pass?
I would say the one you want to take out is sugar, like refined sugar, right? It's that, you know, if you're having a lot of that roller coaster, right? You have refined sugar, your sugar levels go up. Sorry, I didn't repeat the question for the online peeps. She was asking if there's something quick, like 3 foods that we can put in and 3 foods that we can take out in order to kickstart this anti-inflammation, right? So sugar for sure, right? If you have too much of this refined, like I said, the client that was having Coke and chocolate, right? That was totally inflaming him. So that's one thing. Alcohol is inflaming as well if you're having a lot of it, right? In terms of any like packaged products, because a lot of chemicals that go into it. So you can remove those and add in things like, so when it comes to anti-inflammation, right? There's a lot of herbs that are very good. Green tea has actually been studied. I've actually started drinking a lot of green tea recently. That's been known to be very, but you know, you can add in any whole foods, berries, anything that has a lot of phytonutrients, colorful vegetables and fruits. They're all anti-inflammatory, right? If you want one of the herbs that's well studied is curcumin, right? If you curcumin, turmeric. Yeah, turmeric is the herb. Curcumin is the actual active ingredient. So that's, again, that's not for everybody, but being of Indian background, that's part of my diet, right? So if you want to incorporate that, that's one too. But there's actually quite a bit. I can't remember off the top of my head, but just a whole food diet. Excellent. Yeah.
I'm hearing more about college. A lot of people are starting to college.
Yeah.
I'm wondering if it's a fad or if it's on backing it.
So, okay, so repeat the question. Someone's asking about collagen and what's the science behind it and whether it's just a fad. So I don't know about collagen's role from the inflammation perspective. I didn't really research that, but I know collagen has been shown, they've done study to show that it helps with bone building, right? So for example, like when my mom had a hip surgery, right? I started her on collagen because I thought it would help build along with the calcium, the magnesium and all that. I just wanted to make sure that the repair happens in the right way because she was old and I didn't want anything to go wrong and she ends up again in the hospital, right? So there was some evidence in that sense and I started, because it is safe and there was evidence that it would help with that. So I started her on that. But in terms of what are you used, like what would you want to use it for? Like as an anti-inflammatory product, or were you thinking more along the line of wrinkles
I'm
and
hearing that it's strengthening nails, bones.
Yeah. Yeah. So there is research. I don't know exactly the more details of it, but there's definitely research because I know I've done it. I looked at some of the papers and then that's when I started my mom on it. So there's definitely research behind it. Yeah. You had a question.
At some point, maybe you've already done it. Will you address the topic of supplements?
Supplements for anti-inflammation? Yeah. Yeah, so just to repeat the question, someone's asking if I'll be addressing the topic of supplements, right? So yeah, when it comes to anti-inflammatory supplements, there's a lot because I think a lot of people suffer. It's the pain part, and I get it because the pain is real, right? There's a lot of supplements out there, and there's research behind it as well. The common one, glucosamine and chondroitin, right? And I always tell people, those you come to see me, I always tell you guys that try something for 3 months, right? If it's not working for you, it's not going to work for you because every body is different, right? And oftentimes, like I said, there's other things going on. Like I could have, I took turmeric when I was sick, right? And it did nothing for me. And I took a very good quality turmeric because I really needed to work on my stress. I was creating all kinds of inflammatory products because of that. No amount of anti-inflammation was going to work, right? But then I have clients who take curcumin capsules and it's done wonders for them, right? So there are many out there. Some of them are well studied, some of them are not so, right? And I think if you guys want, we can actually do that also as part of our ongoing series on inflammation, because you're right, there is a lot of stuff out there, and how do you know if it's effective or not effective? So we will come to it one day. I don't know if there's any questions online. You guys can unmute yourself if you have a question. If I can check on the chat. Okay, so there is a couple of questions. There's a question about the #1 supplement to reduce inflammation. Like I said, again, there are many inflammation out there, many supplements out there. There are quite a few which are well studied. I don't know if I would mention one as being #1. I know turmeric, curcumin is good. There's another one, PIA. It's a short form for longer name that actually I brought in because I read studies on it. And I thought this is really effective, so I brought it into the store. Collagen helps with that too. So I wouldn't say there's #1. It's really a matter of trying and seeing what works for you. Okay. What would be the #1 action to help avoid Alzheimer's dementia? If you're talking about #1 action, I would say stress reduction. I think that's huge when it comes to the neuroinflammation. So I think a lot of times, and I think when it comes to stress, many of us, and because it hasn't been really part of the medical talk, right? A lot of times we don't talk about it in the medical field, right? But the evidence with stress and disease is so strong that I don't know, and I could be because there's no one pill that you can take to reduce stress. It really requires us to work on it, and maybe that's why. And I remember this incident always stays with me. I used to work at the hospital, and we used to have these regular talks. You know, specialists would come in, and I think it was a cardiologist that came in, and he was giving a talk about heart disease and the risk factors, and he says stress is actually number 2, right after cholesterol, right after diabetes, but it's really high up there when it comes to cardiovascular disease and people getting heart attack, right? And one of the emerge doctors actually got up and said, I know patients coming in and they're stressed, but I don't have any tools. Like, I don't know what to do, how to help them, right? Because really the way our system is designed, there's not enough time to spend to actually explore what's stressing them out and how to help them, right? And so this is real. This is in the scientific literature, but I don't think we're talking about it enough. And I mean, after having experienced it myself, the impact of it, I really think that that's something that needs to become part of the narrative. So yeah, I think that's one thing I would say is good for Alzheimer's. Someone's asking if it's going to be recorded. I think I did start recording, so hopefully, fingers crossed, it's recorded well. And yes, I will post it onto the YouTube. And if you're part of my email list, you will get an email with the link to it. Are uterine fibroids inflammatory condition? Yes, I think they are. I would have to look up deeper into it, but it's quite likely because the body is reacting to something. So I think it is an inflammatory, but I would have to do a bit more research on that. Okay. I think we are good here. Oh, it was PEA. No, it's P as in Peter, P as in Peter, E and A. It stands for a longer term. I don't remember. Do you remember? I can't remember. It's a long chemical name. But it's actually an anti-inflammatory chemical that's produced by the body. And when we are too inflamed, there isn't enough of that to keep up. And so this is like, it supplements that. So it's something I actually took as well. And when I was trying to wean off the anti-inflammatory medications, I took that to find it kind of in between. That was my strategy. I always think supplements should be temporary because there's so many lifestyle things we can do. So that's my take on it. Again, some people may not be completely able to achieve the thing they need through lifestyle, then they can take it longer. From the evidence, there's no toxicity, right? Because it's something that's naturally produced by the body. The body can't keep up with it because there's so much inflammation. And so that's why you're supplementing it. And so there was really good research in Europe as well. And so a few years ago, I think they started making it here. And when I read about it, I brought it into the store and I started taking it too. But again, like I said, I think I always say, go with the lifestyle. As while you're taking all these things, always work on the lifestyle so you can eventually come off it. Like, I'm not taking that anymore, right? But that was sort of my in-between while I came off my anti-inflammatories and this.